All right, welcome back, everyone. At this time, it's my privilege to invite HHS's Assistant Secretary for Health, Admiral Brett Giroir, to the stage. Admiral Giroir is the 16th United States Assistant Secretary for Health in the Department of Health and Human Services, and he serves as the Secretary's principal public health and science advisor and oversees the department's key public health offices and programs, including disease prevention and health promotion, infectious disease and vaccine policy, minority health, human subject protection, 3 presidential and 11 secretarial advisory committees, and the Office of the Surgeon General. Admiral Giroir also leads HHS's efforts to fight America's opioid crisis. Previously, Dr. Giroir served in numerous leadership positions in the federal government and in academic institutions. Most notably, he was the first physician to be appointed as an office director at the Defense Advanced Research Projects Agency. As a pediatric critical care physician, Dr. Giroir cared for critically ill children for 14 years. He continues to bring that hands-on, patient-oriented perspective to his work as Assistant Secretary for Health, and who I have witnessed to be just the epitome of a great leader since I came on board in March. So please join me in welcoming Admiral Giroir.
Well, thank you, Holly, and I think we all know what a fantastic job Holly has done in the few months she's been here. Truly, I can imagine no one to do a job as great as she has. So it is very exciting to see you all back in this room. It's only been a few months since the meeting we had together at the White House to kick this off, and I think it's not only something that I will remember forever, but it, I think, really is a watershed moment in our nation's history. Really turning us back from what we have now as a sick care system to a health promoting system. And the fundamentals of everything we can do to promote health is starting with exercise, fitness, and nutrition. That's the basis of everything. I think this is also an amazing moment because the Surgeon General, Vice Admiral Jerome Adams, and I are actually in the same place at the same time. So, Surgeon General, you want to stand up, please, be recognized? And I wanted to make the comment that we are both very proud members of the Commissioned Corps of the United States Public Health Service. Wearing this uniform today, standing on the shoulders of so many who have given their careers and even their lives in the Commissioned Corps in the line of duty. It is obvious, and I think apparent, that physical fitness and mental toughness are critical to our ability to promote and defend the public health of our nation and around the world. Our service takes care of those whom care forgot in the most austere environments. Today, right now, hundreds of our officers are serving in hurricane and flood-ravaged portions of the Carolinas, on the U.S. border with Mexico, in Africa fighting Ebola, and many other places. Our officers rely on their physical fitness as well as their training and intellect to be able to help others in times of crisis. I have said this before, but nothing less than the future of our nation depends on developing healthy habits, perhaps the most important of which is regular exercise. We spend almost 18% of our gross national product, and most of that is on chronic diseases, the majority of which can be prevented or significantly ameliorated by the kinds of habits, the kind of activities that this council will be dedicated to bringing to our youth and to our young adults and even to our elderly. Regular exercise keeps chronic diseases at bay. And I mean regular exercise, not the 3,000 push-ups a day that Herschel Walker does. At the White House, I knew the rumor because, of course, I'm can't politically say this, but I am a rabid Dallas Cowboys fan. Actually went to some of his games when he was in college, so I knew of his exercise routine. So when we're at the White House, it was still early in the morning. I asked him, so how many push-ups have you done today, sort of in joking. He said 1,500. I said, okay. I haven't. But really, even moderate exercise, walking, gardening, housework, can dramatically lower the risk of obesity and type 2 diabetes, heart disease, high blood pressure, stroke, many cancers, depression, and even Alzheimer's disease can be altered by physical activity. Regular exercise is truly one of our best solutions to our nation's health. It even helps you sleep better at night, consolidate sleep so you have that restful sleep and be refreshed the next morning. And sleep is such a critical factor in our overall health. The simple lack of physical activity costs employers tens of billions of dollars in healthcare costs and threatens our nation's economic competitiveness. I am personally very pleased that the Surgeon General has taken on as one of his many causes the impact on health on our economy. I think this is important for so many reasons, but to bring more people into the cause of public health, to really emphasize that public health is really a national security issue, and it's an economic competitiveness issue. If we have a healthy workforce, it's good for business. Exercise has been proven to enhance worker engagement, energy, focus, mood, and innovation. A culture of wellness can increase productivity, competitiveness, and ultimately the bottom line. I'm also very concerned about our national security. America's national security is critically dependent on whether our pool of recruits is fit and healthy. I learned at my time in the Department of Defense that all of the technology in the world will not substitute for an individual American warrior. But we are facing a crisis in this realm as well. Nearly 1 in 4 young adults are not qualified for military service because they are overweight or obese. 71% of young adults would not be able to join the military if they wanted to because of fitness, obesity, drug use, or lack of education. These are big issues, but issues that we can solve by this committee with the support of this secretary and with the leadership of this president. My office, the Office of the Assistant Secretary for Health, is behind you at every moment as you provide us essential guidance as we endeavor to fulfill the mission that the President has laid out to develop and implement a national youth sports strategy, something that has never before been undertaken by the President's Council. I was also very excited and pleased that the support of Dr. Lynn and the Office of Minority Health to jumpstart some of our activities with the $2.5 million available for grant awards, to start priming the pump, to getting the energy, and most of all, to really put an exclamation point behind the fact that we are serious about this. We're not just going to talk about it, we're going to actually do it and make a difference in people's lives. Each one of you on this committee was picked by the President individually because he felt that your diverse experiences and backgrounds would be essential for success. You have the unique opportunity through your work on this council to increase access and opportunities for all youth, especially underserved youth and girls. I would also be remiss if I did not acknowledge the work of some of the other offices within the Office of the Assistant Secretary for Health that will complement and synergize with your efforts. One of them is the Office of Disease Prevention and Health Promotion, and we have an acronym for everything. We just call it ODPHP. They are serving as the co-lead on the development of the youth sports strategy. The Office of the President's Council and ODPHP have always worked closely together since both missions align so well. For example, ODPHP works with CDC, NIH, and the President's Council to develop and implement the physical activity guidelines for America. The guidelines currently recommend 150 minutes per week of moderate intensity aerobic activity and muscle strengthening activity on 2 days each week for adults, and 60 minutes of physical activity each day for children. The last edition of these guidelines was published 10 years ago, but under ODPHP's leadership, together with the President's Council, the federal partners recently worked with an advisory committee to complete an updated review of the scientific evidence about the health benefits of physical activity. The second edition of these guidelines will be updated, and they're going to be announced by me in November. So don't ask for any preview because I can't give it to you, but in November we will be announcing these guidelines, the updated science, and what I can tell you as a preview is it's going to emphasize even more than it was 10 years ago about the critical importance of just moderate physical activity. If we can get people up, moving, start those habits during the youth, we can really make a huge impact on disease, on health, on readiness, on our nation's economy. You name it, we can do it. However, as you heard the Secretary say, only 23% of adults and only 21% of adolescents meet the current physical guidelines. That's why your role as council members is crucial in helping encourage children and adults to get more physical activity so that more Americans can attain the many health benefits associated with this. So I'm very much looking forward to the outcomes of this meeting, and I know that as we continue this critical work, we can expect robust dialogue and engagement for this council. And speaking of our youth, I understand that now you're going to have the opportunity, I think, to hear from some extraordinarily accomplished young people who are going to share their perspective on youth sports with you. So at this time, I would like to thank you again for having me here. You know that I'm fully supportive of everything that you do. You also saw at the White House that I'm much better at throwing a baseball than I am at catching a football, but I will do whatever I can to support you at every leg of this journey. And again, thank you so much on behalf of our office, the Secretary, and the nation for all the work that you and all the dedicated time that you're giving to this really critically important cause. Thank you very much.
Thank you, Admiral Giroir, for your remarks. Your support has been made abundantly apparent, and we are very grateful for that. And also, Admiral Adams, I'm so glad that you can make it as well. So thank you both. I was told we need 5 minutes for the youth panel to get them mic'd up, but we're going to flip generations now and hear a little bit about hear from the future leaders and inspiration for the council's work, hear from these youth. But we can't expect to make true progress without having their voices at the table. So I'm going to wait just a few minutes before I introduce them. So if you'd like to slip out for a restroom break really quickly or take a sip of water, I'll be right back. Thanks.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.